Right now, every county in Arkansas is considered a high transmission area for COVID-19. That's according to the CDC's community transmission map. You see it right there on your screen. It measures the level of spread in every county in the entire United States. A county is labeled a high transmission area if the total of new cases per 100,000 people exceeds 100 or there's a positivity rate higher than 10%. This comes as Arkansas continues to deal with the hard-hitting Delta variant. 2,203 new cases of the virus were reported yesterday. 41 deaths were added to the state's total as well. And while we did see a dip in our hospitalizations yesterday, that number is still higher than it was the last time we saw a spike in cases, and that was back in January. Tuesday was the third day in a row for a record high number of patients on ventilators in Arkansas. Just 2% of ICU space in our state is free. That equates to 17 beds. Nearly half of all intensive care patients in Arkansas are there because of COVID-19, and many hospitals are not able to accept an infected patient.
The numbers are concerning, but it is the severity of illness. It's how sick the patients are that is the most troublesome.
In Little Rock, UAMS has had between 65 and 75 COVID patients in the hospital over the last several weeks. UAMS has a surge plan in place and has added 60 more patient beds just in the past week. Another side effect of surging cases, ambulance services have also been struggling to keep up with all the calls. We have been hearing stories of what healthcare workers on the front lines are experiencing in the COVID surge in the hospitals. Now we have the story of those who see patients before they get there to the hospital, the emergency medical workers. Almost all of the COVID patients who need their help have not received a vaccine. David Begnaud rode along with the crew in Louisiana.
How long have you been waiting?
I have been waiting for 3 days.
We were right there when 48-year-old Julia Clay was loaded into the back of an Acadian ambulance and transported to Our Lady of Lourdes Regional Medical Center in Lafayette, Louisiana. 59% of the beds here are filled with COVID patients, and 93% of them are unvaccinated.
Waiting, and I'm taking the vaccine.
You wish you would have taken the vaccine?
Yeah.
Acadian Ambulance is the largest privately owned ambulance company in the country. We spent 3 days with them. Dr. Chuck Burnell is their chief medical officer.
Around 30 to 40% of our call volume involves COVID patients.
Trent Tarbutton is a field supervisor. He took us to Lafayette General, where ambulances were backed up because there were no ER beds available. Recently, medics have had to wait here with patients anywhere from 30 minutes to 3 hours.
We kind of just have to tell the hospital, you have to put them somewhere because we need to run emergencies.
Louisiana has a call center in Baton Rouge that is focused on finding available beds and advanced care for patients around the state.
So y'all can't accept?
We were there when trauma care coordinators tried finding a bed for an elderly man in central Louisiana who had gone into cardiac arrest. There were 15 hospitals within 100 miles.
They have no beds, no staff to take care of it.
Y'all not going to transfer?
After 2 hours looking, the patient's condition had worsened and he could no longer be transferred. Again, Dr. Chuck Burnell.
A lot of patients that we deem would not probably benefit from the hospital are already being treated in place at home and being left at home.
They have not refused to transport anyone yet.
We're days away from that happening right now.
It's the unthinkable, but he's got to juggle other priorities too, like speaking almost daily with medics who are not vaccinated.
You're up close with it. Does that not change your opinion?
No. I'm me and my family are very religious. We pray a lot.
Yes, I should be vaccinated. That is very careless of me, because I do come in contact with other people. Will I be vaccinated soon? Yes.
And yesterday it happened. Keontae went to get the first dose of the Pfizer vaccine. One thing about Louisiana is they are at a terrible place right now with hospitalizations and cases continuing to soar. But you know what else is rising sharply? The vaccination rate. David Begnaud, CBS News, Lafayette, Louisiana.
And we are seeing a rise of vaccinations here in Arkansas as well. More on those numbers here in just a second. But first, this. New at noon, U.S. health officials are now recommending all vaccinated Americans get COVID-19 booster shots to build their protection. The new guidance comes as the Delta variant continues surging across the country and evidence that the vaccine's effectiveness is falling. The plan created by the CDC and other officials calls for an extra dose 8 months after people get their second shot of either the Pfizer or the Moderna vaccine. They could start being administered the week of September 20th. People who received the single-dose Johnson & Johnson shot will also probably need extra shots. However, officials say they're waiting for more data before creating a plan for that group. The development comes as state and health officials continue urging Arkansans to get their first dose of the vaccine. And that effort appears to be working. Close to 13,000 doses of vaccine were administered yesterday. According to Governor Asa Hutchinson, we're getting closer to 50% of the state being fully vaccinated. Right now, 1,135,000 people are fully immunized. Another 354,000 are now waiting on that second shot. The city of Fayetteville doing what it can to encourage people to roll up their sleeves. Last night, the city council voted to use COVID-19 funds to pay residents and workers in the area who get their vaccine. Starting today, the first 4,000 who get a shot will each receive $100. The city council says it's a small price to pay to keep people safe.
We may save lives, and not just, the 4,000 you vaccinate, well, the people that don't get COVID because these people were vaccinated. Assume that if we were to actually vaccinate another 4,000 people, it would save the city, hospitals, et cetera, the U of A, way more than $400,000.
If you'd like to learn more about the vaccine or where to get one, we've got you covered. Text the word vaccine to 501-376-1111. We'll send you a link to those resources. One of R. Kelly's long-awaited trials is now underway in a federal court in Brooklyn. Prosecutors claim the singer used bodyguards and other employees to run a criminal enterprise involving the sex trafficking of women and underage girls. He also faces sex-related charges in Illinois and Minnesota. The U.S. is rushing to increase the number of people it can evacuate from Afghanistan ahead of the August 31st withdrawal deadline. Meanwhile, there are reports of chaos outside the Kabul airport. A NATO official tells Reuters there was a stampede at one of the gates there, and the Taliban is reportedly blocking Afghan citizens from leaving. In the eastern city, Halabad, a health official says at least one person is dead after Taliban soldiers fired into a crowd protesting against the new government. National intelligence analysts say there's also a concern about heightened terrorist threats, especially around the 20th anniversary of 9/11.
Anybody in the intelligence business right now here in the United States who doesn't understand we're in a heightened threat position isn't reading the analysis.
The Taliban held its first press conference Tuesday, claiming it will respect women's rights. But the U.S. joined 46 other countries in a statement saying, quote, "We're deeply worried about Afghan women and girls, their rights to education, work, and freedom of movement." With such a rapidly changing story, it can be hard to make out what's actually happening in Afghanistan. The dramatic and heartbreaking images of people desperate to flee have been spreading across social media, but not everything you see is entirely true. That's why our Verify team is hard at work separating fact from fiction. Here's Evan Kosloff.
The Verify team is here to make sure that you're only getting the facts when it comes to the recent events in Afghanistan. Take posts like this. The U.S. funded, trained, and armed Taliban to fight the Soviets, wrote one person. So let's verify. Did the U.S. government directly fund the Taliban? Here are our sources. Benjamin Hopkins, a professor of history at the George Washington University. Charles Dunbar, a retired ambassador who worked in Afghanistan in the 80s for the State Department. Mike Lyons, a military analyst. And this report from the Congressional Research Service.
There are linkages, but it's not a direct line.
According to Hopkins, in December of 1979, the Soviet Union sent troops to Afghanistan to protect a communist government. Those troops remained in the country for a decade. Hopkins says that in response, the CIA began sending money through the Pakistani government to the Mujahideen, a group of Islamic militants that were fighting the Soviets. It was deemed Operation Cyclone.
That Operation Cyclone started out very small until finally to the point where it was literally billions and billions of dollars.
This was confirmed by a Congressional Research Service report stating that a total of about $3 billion was given to the Mujahideen from 1980 to 1989, according to the State Department. So how does the Taliban play into all this? Well, according to our experts, the group first began to form in 1994, so money never went directly to the Taliban.
There is a story of Americans arming an anti-Soviet insurgency, some of whom then go on to become part of what will be the Taliban.
Some U.S. funds went to supporting the Mujahideen, who had generally the same point of view as the Taliban.
But any sort of direct linkage, U.S. arming the Mujahideen in the 1980s supports the Taliban in the 2000s, is incorrect.
So we can verify that false. The U.S. government never directly funded the Taliban, but they did support the Mujahideen fighters in the 1980s. With your Verify, I'm Evan Kozlov.